Hi everyone, my name is Dr. Christine Anderson. My patients call me Dr. Chris. I am a pediatric chiropractor of over 30 years, and I also see pregnant women, and my subspecialty is functional neurology. So I have a certification in childhood developmental disorders. And I am finishing up this series on primitive reflexes with the Landau Reflex, also known as the airplane reflex. And you can see in the picture there that cute little baby with their arms and their legs up, just like you would play airplane. So we're going to learn about this reflex. We're going to learn what if it isn't there, what if it doesn't evolve? And also, what happens if this reflex does not integrate and continues to be active and is retained in an older child? And I will explain how this can cause things like poor posture, gross motor tone issues, visual and spatial problems, and challenges which require coordination like hopping, skipping, jumping, marching, somersaults, jumping jacks, all of those things that we associate with kids doing. Retained primitive reflex, the Landau reflex, can also lead to poor short-term memory and other issues about learning in school, concentration issues, attention issues, and can even lead to depression. So let's jump right on in. And before I start talking about the Landau reflex, I want to just remind you that I did a video on the neurologic reflexes, an overview. I'm going to put the description in the link below. Once I finish, I recommend checking that out, as well as the video I did with the overview of primitive reflexes, how they help us to be born, survive, and develop our brain. They are the foundation for childhood brain development, which is the foundation for adult brain development. So I do, again, encourage you to check that out as well. And all of the primitive reflex exercises will be put onto a playlist that will be available as well. All right, so the Landau reflex, also known as the airplane reflex, you can see right there a picture when you hold the baby underneath their belly. They're going to extend their legs and they're going to extend their arms. And usually the arms are out to the side. They might be in the front if there's maybe a toy out in front or there's something that they want to reach. But everything is what we call an extension. Now, this is actually a reflex that isn't quite a primitive reflex, but I'm putting it with the primitive reflexes. It's really more of a bridge reflex to the writing reflex and postural reflexes because babies are not born with this reflex. It actually is going to develop starts around 2 to 3 months, the upper part. So when babies are laying on their tummy, they're going to start to lift their head, and then they're going to start to lift their chest. So this is the first part of this reflex. And then around 4 months, they're going to be able to start to lift their legs. So it's not a postural reflex because it should not persist after, ideally, the age of 1 year, but at least not after 3 years. We shouldn't see this reflex occur. A child can get into an airplane position, but it's volitional. They go, I want to be an airplane, and they put their arms out and they put their legs out. But they're not beholden to this reflexive action, which is automatic. There's no control over it. So that's the Landau reflex. And some of the things that it does is, first of all, it helps develop posture, especially things like the neck and the low back curve. So we're actually born in a C shape, just like this, and we develop, or actually that's a backward C on it. So more like this, our spine is in a C shape, And we develop the neck curve and the low back curve. These are secondary curves of the spine to acquire that typical sigmoid curve that we've all seen, especially in a chiropractor's office. We all have our spine. It's it's a requirement. We have to have one. But the development occurs during tummy time, which is the precursor to be able to do this Landau reflex and then develop and prepare the muscles for crawling, because if they don't have enough muscle strength, they're not going to be able to get up onto their hands and knees and support their weight. They also have to use this reflex to push up against gravity. So lifting the head up and lifting the arms takes a lot of work. Look, if you do this airplane exercise on the floor, it's hard. I know it's hard for me. So it takes a lot of work to push up against gravity. It takes a lot of core muscle strength. And then what it's also going to do is, as they start to look up and reach for things, it's starting to have that hand-eye coordination and that convergence of the eyes, and using their eyes and looking and finding what is that visual reference point, how far away things are. So this is really an important reflex. Even if it isn't a true primitive reflex, it is important in the brain development. So first, I always want to talk about, what if we're checking a baby who's 2, 3, 4 months old, maybe 5 months at the latest, and we're not seeing this happen. We hold up that baby by their belly and they're kind of floppy, or they're not lifting their arms, or they're not lifting their legs maybe. What does this mean? Well, it means, number one, they're going to have low muscle tone because they're not able to hold their arms and legs up. Now, why they have that low muscle tone? Well, there can be a myriad of things that I'm not going to really go into, but this is one of the reasons why they would not be able to do the Landau reflex. So another video for another day for the hypotonia, or the low muscle tone. They might also have cranial restrictions or subluxations, which can be misalignments or restrictions in the spine and the skeleton and the axial parts, the extremities. And so cervical would be neck, lumbar is low back, sacrum is that triangle-shaped bone at the end of the spine, which, by the way, in babies is going to be into segments. Pelvis, shoulders, clavicle, which is the collarbone. So if there's any misalignments anywhere that are going to prevent that communication between the brain and those muscles, they're not going to be able to do the exercise, or maybe it's better on one side than it is the other. So of course, this is where a chiropractor comes in to check out to see if there are any cranial issues. And I will put in a video in the link below, in the description below, which will go over craniosacral therapy for babies, which explains about the craniosacral system and its importance, and how craniosacral therapy can help that. So if there are any subluxations, if your child's not doing this reflex, take them to a chiropractor who specializes in pediatrics to make sure that there are no restrictions to this reflex being performed. If you are keeping your baby in contraptions, and what I mean by that are car seats, swings, bouncers, jumpers, saucers, these types of devices where babies are strapped in and not allowed to move. So in order for the brain to develop, they need movement. I am not a fan, if you've seen my videos, I'm not a fan of contraptions. They must do floor time. They must do tummy time, and it starts early. So early on, when a baby doesn't have much head development, you can put them on your chest. You lay down, mom or dad, and you put the baby on your chest, and it gives them an ample space to breathe, look at your face, try and lift their head. They've got to practice this to get that communication between the brain and those muscles that hold the head up. So they must have floor time, and specifically tummy time, to have this reflex develop. Now, this also, if there is no Landau reflex with a low muscle tone, it might also be a sign, a marker of a delay in mental maturation, because it is part of that brain development process. So there will be other things involved as well. It won't be just this reflex being absent. And so I just want you to be aware of that. It's not what I typically see, but it can be something to consider, especially if there's a lot of things going on. All right, so why is it so important that we integrate this Landau reflex? What's the big deal if it doesn't, go away and stays retained? Well, first of all, when it is integrated, then a child will be able to do the action of lifting up their head and their arms while keeping their feet flat on the floor, because those two things are not tied together. In the reflex, arms go up, legs go up. You can't separate that. So that is how I check for this, to see if a child is able to lift their arms out in front while keeping their feet on the ground. The importance of this integrating also means that you're going to have integration of the tonic labyrinthine reflex. And of course, I'll put the link below because I've done a video on this already. And other primitive reflexes as well. They are going to, by integrating this reflex, they're going to have a strong back core, and they're also going to have that ability to grasp things when they are prone, which is on their belly. And then I talked about this convergence of the eyesight and the near vision, which are necessary for things like reading. They're going to have good gross motor coordination between their upper and lower body, and from the front and the back, because they can separate the movements from the top half and the lower half, and they are also integrating that front and the back core and the front core. If you've got too much front core and not enough back core, everything's going to be bent over in flexion, and it's going to be hard to sit and stand up properly. There's also a link between body posture with positive emotions, and it relates to this Landau reflex. So let's look at what a retained reflex looks like. So like I said, it should integrate really ideally by 12 months, maybe 24 months, at the very latest at 3 years. So the little girl in the picture there, she's got her legs up and her arms up. So that is definitely a sign the Landau reflex is retained. Or sometimes I see that the child will be having their feet on the ground, but they're straining to lift their arms out in front of them and lift their head up. So there's that aspect as well. But this is a typical thing you'll see if the reflex is retained. They just can't keep those feet down easily. If your child has a retained Landau reflex, you might see they have postural issues and possibly low muscle tone. So, they're slouchy. They will, at their desk, they'll like drape themselves over their desk. They can't sit up straight. It's like, sit up straight. They just can't do it. They also will tend to have tension in the back of their legs, so that you'll see them when they stand, they push their knees back and hyperextend them. And they may also, as a result, do some toe walking, especially past the age of 5. That poor coordination between their upper and lower halves of the body means that they are going to have awkward movements. They're going to have maybe some weird gaits. They might not move the top half of their body as they're walking. They're going to definitely have challenges with all the things we think of with kids, with hopping and skipping and jumping and marching and swimming, especially the breaststroke, because your legs are doing one thing and your arms are doing another. And in general, they don't really want to do sports because it's hard. All the coordination and the hand-eye coordination, and they've got to, focus, and they have to organize what they're going to do for the game. They have sometimes poor endurance, so they're usually not loving to do sports in general. One of the key things is that it prevents brain stimulation that's needed for concentration and social decisions. So they're going to have difficulty with attention and focus and concentration. They're going to have poor short-term memory. They're going to have trouble with activities of transitioning. If they, just going from one thing to the other doesn't really work for them. They might have trouble with impulse control or difficulty being assertive. They will have typically weak organizational skills. They can't organize their thoughts to put them down on paper. They can't organize their homework. Everything's just kind of shoved in their bag. They're habitually late because they can't organize their time. There's going to possibly be problems with vision, especially near vision. Like I said, because of this connection between the posture of joy and happiness, they may have depression or even a lack of emotions. And this can also affect their cardiopulmonary system, so heart and lungs, and they can have poor endurance. Now, if you see that the Landau reflex is retained, I highly recommend going back to the other primitive reflexes and checking those to see if they're retained. Because remember, this is a bridge reflex. And so if this one is retained, chances are there's another reflex that is retained. So if your child is having bedwetting issues, you might want to go back and check out the spinal, galant, and Perez reflex, because they might have that one as well as this Landau. Or if they have poor concentration in the classroom, go back and check the other reflexes as well. So what is the remediation? Well, we're going to do Superman, and we're going to try and have the feet down and the arms in front. Now, this may mean helping the child with keeping their feet down, or in the bottom picture there, sometimes I have to start with the arms going back before I can bring them in front because of that lack of core strength. So I have to meet the children where they are and take them where I would like them to go. And then, of course, we've got some variations. So you can see the little guy in the top left there on a ball, which makes it super fun. This is really great to do with younger kids, 1 year, year and a half, 2 years, where it's really hard to get them to just lift their body up if this is a problem. So the ball gives them a little bit of lift, and you're rolling them, and it is super fun. Usually they like to do it. And then on the top right there, you see the little guy there. He's on the ball, and he's playing with the water. So, or you can have your child play with some toys. So I find the ball is really great, especially with the younger kids, but of course older kids can enjoy it too. They can hook their feet under something and lift their arms up to the side or to the front, or you can hold their legs on the ball down while they lift their body up. So there's so many ways to use these exercise balls. They're so great for kids. And they're great for them to use as a chair as a chair rather than a chair, because it helps with posture and the core strength. And it allows for movement, and it allows for their eyes to move as well when they're sitting at the computer. So I highly recommend getting an exercise ball that fits your child so they can sit on it. You can have bigger ones too. Maybe to play along with your child as well. That's super fun. And then, of course, it's not exercise if you're with friends and having fun. So the bottom picture with the Superman friends. Reminds me of parachuters that come together. And you can do this with your child then if you don't have other kids around. But, when kids are around, institute some of these fun games, right? We don't call them exercises for kids. We're going to do some fun things and play Superman. You have to play everything, and it will help them with their strength and their integration of primitive reflexes, and they don't even need to know it. All right, so this is where you can find me at losangeles-chiropractor.com. I have so much information on there, and I've got all the links to my YouTube shows and podcasts and all those fun things. Besides having 30 years of clinical experience, I have 30 years also being a mother. So lots of on-hands learning with my children. They definitely are great teachers. And I can do remote and in-office services. So obviously the hands-on work is the chiropractic and the cranioscral work, but I can do a lot of these evaluations and remediations and functional neurology and childhood developmental issues that I can work on remotely as well, and try to find you somebody in your area for the hands-on work. So, feel free to reach out to me, even if you don't live in the area. All right, that's it for this presentation. So don't forget to share this with people. It is so important that you share this with pregnant women, women who just have had children, or if you see friends with children that are struggling, let them know that there are things out there that they can do. Just, send them this video. Thanks so much. Subscribe so that you can receive notifications when I do a video. Typically, I come on live every Tuesday, 7 p.m. Pacific time. If you ever want to join me live, you can also ask questions. And otherwise, you can watch the replays. All right. Have a great evening, and I will see you next time.